That extra weight sitting around your midsection isn't just stubborn fat refusing to leave. It's actually your body's most visible warning system, sending real-time signals about what's happening inside your arteries right now. A 2023 study published in the Journal of the American College of Cardiology found that belly fat is a more accurate predictor of heart attack risk than your actual body weight or even your BMI. And by the end of this video, you'll know exactly how to read these signals and what to do about them before your doctor ever mentions the word statins. Here's what most people don't realize. Belly fat, specifically visceral fat, the kind that wraps around your internal organs, isn't just sitting there passively. It's metabolically active tissue that behaves more like an endocrine organ than simple storage. According to research from Harvard Medical School, visceral fat constantly releases inflammatory molecules called cytokines directly into your bloodstream. These molecules travel straight to your arterial walls, triggering a cascade of events that fundamentally changes your cardiovascular risk profile. This is exactly why two people at the same weight can have completely different heart health outcomes. Let's break down exactly what's happening inside your body when belly fat accumulates. Think of visceral fat like a chemical factory that never shuts down. Every single day, it's producing and releasing over 30 different bioactive substances into your circulation. The most dangerous ones? Interleukin-6, tumor necrosis factor alpha, and resistin. These aren't just complicated names, they're inflammatory compounds that your cardiovascular system was never designed to handle in high doses. Here's where it gets really interesting. When these inflammatory molecules hit your arterial walls, they trigger your immune system to respond. Your body interprets this as an injury that needs healing. So white blood cells rush to the scene, burrow into the arterial lining, and start consuming oxidized LDL cholesterol particles. Over time, these cells become foam cells, bloated immune cells packed with cholesterol. They accumulate, harden, and form what we call arterial plaque. But there's a catch most people completely miss. This process doesn't happen overnight. It's silent, progressive. Most people have zero symptoms while their arteries are slowly narrowing for years, even decades. A landmark study from the Framingham Heart Study tracked over 3,000 adults for 25 years and found that for every 4 inches of increased waist circumference, cardiovascular disease risk jumped by 15%, independent of total body weight. And this is exactly why it matters so much after 40. As we age, hormonal shifts, declining testosterone in men, dropping estrogen in women, make it exponentially easier to accumulate visceral fat and exponentially harder to get rid of it. Your body's default setting literally changes. Now, let's talk about what goes wrong when this mechanism runs unchecked, and why you're probably feeling it right now without even realizing it. If you've noticed your energy crashing hard in the afternoon, or you wake up feeling puffy and stiff despite sleeping 7 hours, or your brain feels foggy by mid-morning, that's not just aging. That's systemic inflammation driven by visceral fat circulating through your bloodstream 24 hours a day. Here's exactly what's happening inside your cells. Those same inflammatory cytokines we just discussed don't just damage your arteries. They interfere with insulin signaling. Your cells become resistant to insulin's message, so your pancreas has to pump out more and more just to keep your blood sugar stable. Over time, this creates a vicious cycle. High insulin promotes more fat storage around your belly. More belly fat releases more inflammatory molecules. More inflammation worsens insulin resistance. Round and round it goes. The long-term consequences? Profound. According to a 2022 meta-analysis published in Circulation Research, individuals with excess visceral fat have a 44% higher risk of developing coronary artery disease, even when their cholesterol and blood pressure numbers look normal on paper. Because the damage is happening at the cellular and vascular level long before standard blood tests pick up warning signs. Stay with me because this next part changes everything. Belly fat also disrupts something called endothelial function. Your endothelium is the thin inner lining of your blood vessels. When it's healthy, it releases nitric oxide, a molecule that keeps your arteries flexible, dilated, and responsive. But chronic inflammation from visceral fat destroys endothelial cells' ability to produce nitric oxide. Your arteries stiffen, blood pressure climbs, clot risk increases. But here's the good news, and this is why you're still watching. Every single mechanism we just discussed is reversible, not manageable, reversible. Here's the exact protocol backed by peer-reviewed research. Step 1. Target visceral fat specifically with metabolic fasting windows. This doesn't mean extreme calorie restriction. It means creating a daily eating window of 8 to 10 hours with at least a 14-hour overnight fast. A 2021 study in Cell Metabolism found that time-restricted eating reduced visceral fat by an average of 7% over 12 weeks, even without calorie counting. Why? Because extended fasting periods lower insulin levels, which directly signals your body to mobilize visceral fat for energy. Start with a 12-hour overnight fast, say 7 p.m. to 7 a.m., and gradually extend to 14 hours as your body adapts. Step 2. Prioritize omega-3 fatty acids to directly counteract inflammation. Wild-caught fatty fish, salmon, mackerel, sardines at least 3 times per week, or supplement with high-quality fish oil providing at least 2,000 milligrams of combined EPA and DHA daily. Clinical trials published in the Journal of Clinical Lipidology show that omega-3s reduce the production of those exact inflammatory cytokines we discussed earlier, interleukin-6 and tumor necrosis factor alpha, by up to 30% within 8 weeks. Step 3. Incorporate resistance training twice per week minimum, not cardio, resistance training. Because muscle tissue is the single most powerful regulator of insulin sensitivity in your entire body. When you build and maintain muscle mass, your cells become dramatically more responsive to insulin, which breaks that vicious cycle we talked about. A landmark study from Harvard showed that adults over 50 who performed resistance training just 2 days per week reduced visceral fat by 11% over 16 weeks, even without changing their diet. Once you do this consistently for just 2 weeks, here's what begins to happen inside your body. Inflammatory markers start dropping. Insulin sensitivity improves. Your liver begins metabolizing stored visceral fat. And most importantly, your endothelial cells start producing nitric oxide again, restoring arterial flexibility and function. Most people stop at step 3. But there's one more thing that can accelerate your results by up to 40%, and it's something your doctor has probably never mentioned: soluble fiber, specifically 10 to 15 grams per day from whole food sources. Here's why this matters. Soluble fiber, found in foods like chia seeds, flax seeds, oats, Brussels sprouts, and avocados, forms a gel-like substance in your digestive tract that directly binds to inflammatory lipopolysaccharides produced by gut bacteria. By reducing these inflammatory compounds before they even enter your bloodstream, you cut off inflammation at the source. A randomized controlled trial published in Obesity found that participants who added just 10 grams of soluble fiber daily lost significantly more visceral fat over 12 weeks compared to those who didn't, independent of total calorie intake. The researchers discovered that soluble fiber also increases production of short-chain fatty acids in the gut, which directly communicate with fat cells to reduce inflammatory cytokine release. Add 2 tablespoons of ground flaxseed to your morning routine. That simple change delivers 7 grams of soluble fiber and starts working immediately. Here's the single most important thing to take away from this. Your belly fat isn't a cosmetic problem. It's a communication system. And now you know exactly what it's been trying to tell you about your cardiovascular health, and more importantly, how to respond. You now understand something about your own biology that most people will go their entire lives never knowing, that the path to a healthy heart doesn't start with a prescription. It starts with understanding the signals your body is already sending and taking consistent, intelligent action based on science, not guesswork. This isn't about perfection. It's about progress. It's about staying vital, present, and capable for the people and experiences that matter most to you. If this helped you connect the dots between what you see in the mirror and what's happening inside your arteries, hit that subscribe button, because next week we're covering everything your blood pressure says about your metabolic health, and it connects directly to what we just discussed today. Drop a comment below and tell me, what's one change from this protocol you're committing to starting this week? And if this information helped you, hit the like button. It helps this reach someone else who needs to hear it.